Hi, I am Dr. Nalisa Neuendorf. I am a research fellow in the Sexual and Reproductive Health Unit here at the PNGIMR. And it's my great pleasure to chair a session this morning on our social research work in public health. Just reflecting on what our director has talked about, Professor Pomac, and also Professor Isika. I think what's really apt is that in innovating for the future, we are reflective of our past. We're also taking stock of what's happening now, of our present. And certainly the presentations this morning have been a great example of that, of what's happening in the PNGIMR now, inciting for our future work. So this session will provide a short snapshot into the practice of social research in PNG, as told by Papua New Guinean researchers working in the space of sexual and reproductive health. Much of our social science research work is influenced by Indigenous and decolonizing methodologies, in principle and in practice. As such, our teams aim to promote and to recognise each member has strengths that contribute to the outputs of research and to broader conversations about health and people in PNG beyond the very important clinical and lab work that we do. The presenters this morning are a true reflection of this frame. And just to give you a little bit of an understanding of what they'll be talking about, some of our broader messages in this session are that social science perspectives can be translational, particularly when used as a tool for exploration toward understanding specific public health issues, health concerns, and also strengths and opportunities. And secondly, the first step in decolonizing research methodologies is by accepting the challenge that is set before us with research as Papua New Guinean researchers in PNG, through developing skills, deepening experience and knowledge, and contributing through local understanding, being supported and in support of equitable research partnerships. As a little bit of background, the work of the social and behavioural section within the Sexual and Reproductive Health Unit builds on decades of formative work, including in the area of HIV, in gender, in maternal and child health, in society and human behaviour, and more recently in the areas of TB, malaria, and COVID research. The expertise of the section includes both qualitative and quantitative methods, and more recently integrating new technologies, which our first presenter will be speaking on, covering all regions of Papua New Guinea, from urban to remote and rural settings, with gendered approaches. While we've got numerous publications and manuscripts and have contributed to books and book chapters, project reports, and also advocacy when and where appropriate, there's still a lot more work to do in terms of what social research can contribute to public health. The continued work of the section provides insight into matters of social, cultural, and moral significance, to attitudes, behaviours, understanding, and knowledge around identified public health issues. Our first presenter, Ms. Agnes Mek, has at least 15 years of social research experience and several first and co-authored papers. This morning, she will be talking to us about the importance of participatory methods and the use of new technologies in social research. Our second presenter this morning is Mr. Herick Aeno, who has up to 20 years of social experience, social field research experience as a field officer and now contributing to academic authorship and also program coordination. Herick will talk about previous gender research that he has been involved in the unit, and also a current project that focuses on young people and pregnancy. Our final presenter today is going to be Mr. John Cowan, who has 5 years of social research experience. John will be talking to us about his research journey, focusing on the process of developing in the space that he has been placed.
Thank you, Nal. Good morning, everyone. My name is Agnes Mek, a social scientist from Jiwaka province in the highlands of Papua New Guinea. My presentation today is on decolonizing research from research to researcher through images and storytelling. What does colonizing research mean? It means different things to different people because of our positions, based on ethnicity, citizenship, and education. But it also means being a woman, a mother, and from a tribe. It allows me to share my stories as a Jiwakan woman, a social researcher, to share my stories working amongst the multicultural societies of Papua New Guinea and international academics by bringing to the forefront the critical reflections of those living on the margins through words and images that have deeper meanings and insights. For example, we have got words such as fire rice, caliphate, dinner marriage. These words may be meaningless, but they have got deeper meanings and titles. Experiences of Polynesian indigenous researcher. I struggle between my Western trainings and conducting research among my communities, that is whether to uphold the research ethical practices or modify and adapt to the local context without losing the focus of the research topic. Sometimes I become disconnected between the demands of research conducts and local realities encountered, given the complex PNG cultures and geographical conditions. So it is quite challenging and my role becomes blurred. Decolonizing Western scholarship in PNG. In Social and Behavioral Research Unit, we integrate contemporary Western approaches such as arts-based methodologies of participatory action research, which I find have important elements of decolonizing indigenous research and practice. They provide equity of subjects, involvement, and participation to become active researchers, as shown repeatedly in our data. Under the mentorship of international partners, I have published as best author and co-authored a number of reports and films which Nalisa had mentioned. One of the methods that we have integrated in our research recently is called photovoice research method. Photovoice is a creative visual method which involves the participants being trained and given cameras to document, write, or record an experience or an issue that affects their health and well-being. This is an approach extensively used in our more recent studies, for example, the WHO COVID-19 study. The goals of photovoice is to enable people to promote critical dialogue and knowledge to reach and influence policy and decision makers. The quote there, what the experts think is important may not match what the people at the grassroots think is important. And that's from Wang and Redwood Jones. In conclusion, it is important to understand that we as researchers are links and voices representing our people, their daily lives, and normal and ordinary words, actions, and images have significant meanings. This extract is from a poem by Tamara Iga, a 12-year-old girl, summarizes my presentation. The title is Endurance of the West. They arrived and started controlling. We were aware of our captive future. We were unaware of our captive future, trying to preserve our carefree, colorful culture. Do not be ashamed of who you are. Embrace your unique country and its colors. Racism should no longer be a rule, and we're making it come true. Thank you.
So we're just going to cross over to Herick Aeno, who's our second presenter today. And as I mentioned, Mr. Herick Aeno is a senior social researcher in the Sexual and Reproductive Health Unit, and he'll be talking a bit about gender work in our SRHU unit.
I am Herick Aeno, and I have been working with the PNG Institute of Medical Research for 20 years now, and involved in many social and behavioral research. Again, I am a senior social researcher and currently coordinating the adolescent teenage pregnancy study. Over the years that I have worked at the Institute and the studies that I have been involved in, which all were social and behavioral, with focused on HIV, sexually transmitted infection, sexual and reproductive health. And some of the more prominent studies that I was involved in include penile cupping and male circumcision, social impact of ART therapies, research among male and female sex workers, and people with diverse sexuality, as they would like to be referred to in Papua New Guinea, transgender women, gay, and MSM. I was also part of the team that took part in a rapid assessment of criminal law, HIV, sex work, and male-to-male sex in Papua New Guinea. Another big study that I was a part of was the mass community study that mapped how individual communities. Yeah, with the various projects or research projects that I've worked with, gender has been a big part of those researches. And they include understanding the gender dynamics that affect health and lives of people, the health disparities that exist between men and women, social processes that make the health needs of men, women, and men with diverse sexuality differ or vary, and also the knowledge gaps between the different genders that exist. Also, the gender diversity and the gender variance that exist in PNG is also explored, including understanding gender, women, gay men, and men with MBS. Gender rights are also focus of the researchers that we have taken on over the years. Presently, I coordinate the adolescent pregnancy study. This study came about because of the adverse outcome associated with pregnancy among the young women, and remains a major health challenge and policy priority in many low and middle income countries, including PNG. Also, limited attention has been given to young men or boys' experience of pregnancy, and there is little to engage young men in efforts to reduce harm associated with pregnancy at a young age. This is important as gender dynamics are central to young people's relational experiences of conception, abortion, childbirth, and parenting. The study is a qualitative one and was carried out in 3 sites, representing urban, peri-urban, and rural settings in Papua New Guinea. 72 interviews were conducted with young people aged 15 to 24. Currently, all the semi-structured or the interviews have been done, and the visual method of photovoice is still pending and should be done soon or later this year. From this study, some findings have already emerged, and these findings have been put together to contribute to a book as a chapter, which I am leading. And some of the findings include tension between family and community expectation that such young men should not be sexually active prior to marriage. Young men involvement in sexual activities before marriage is highlighted. Also, circumstances that inhibit sexual practices that prevent pregnancy is also captured. And then the agentic practice, in particular relationship aimed at preventing pregnancy. My takeaway message is that the work I've done highlights how gender is conceptualized in PNG society. Regional differences such as being from the Highlands contributes to how I as a researcher understand gender and how this understanding can grow based on the social research that I do. I acknowledge our partners, KB Institute, UNSW, the communities of Mount Hagen, Bernard, and Lay, where the study was carried in, and of course the field team and the support team at PNGIMR. Thank you.
Just to again introduce our third presenter, Mr. John Cowan will be speaking about his research journey from when he first started at the PNGIMR up until today.
Thanks, Nalisa, for the introduction, and thank you, Herick and Agnes, for your presentation. My name is John Cowan, and I am a social researcher here at the PNG Institute of Medical Research, attached with the Sexual and Reproductive Health Unit. And I will be talking about my journey as a social researcher. I have joined the Institute of Medical Research back in 2017 as a data entry clerk, and I was basically doing the data processing part of the work at the Sexual and Reproductive Health Unit with other data processing staff members. And I was basically doing prescribing translating and editing transcripts all across the different studies being undertaken by social and behavioral research unit, that is sexual and reproductive health. And at the moment, I'm also doing this apart from other duties. As a data processor, I see that the data processing is very, very important and plays an integral part in social research work because most of the studies undertaken by the unit with regards to in-depth interviews, that is qualitative interviews and focus group discussions, photovoice, are all most of them, almost 95% of them are done in Tokpishin, which is the common language spoken throughout the country. So as data processors, we make sure that transcripts are transcribed appropriately and translations are done properly, so as editing to make it easy for coding and analysis. As a field officer, I was first of all introduced to the field as an observer, where I was basically taking field notes, sitting in with the senior staff members, conducting qualitative interviews, focus group discussions, and photovoice, where I've learned a lot by being an observer out in the field. And thanks also to the senior staff members and the project coordinators who have been by my side, helping me, telling me what to do, what not to do, how to go about conducting interviews. And most importantly, I've come to learn the importance of fieldwork, where networking is very, very important. And we as field officers, we do out in the field means a lot because it helps us to collect quality data. And communication with our partners, stakeholders, the study participants, people on the ground, plays a lot of role, significance in the data collection process. With regard to interviews, I've been given a chance to conduct interviews with under the supervision of my project coordinator and also with some senior staff members on the site, where it has also helped me in my research work. Currently, at the moment, I'm leading the TB study team. I'm taking over from one of our colleagues who has left us, and I'm managing the TB data and also coordinating and organizing of planning field work, which we're supposed to be going out into the field to do the final part of the study, which is the photovoice training or session, and also to disseminate the preliminary findings to the stakeholders and the study participants or the wider community. But due to the election violence and stuff, we have decided to defer the field trip probably to the end of this month. And the aim of the TB study is to investigate the social cultural beliefs and the behaviors that sustain and enhance the transmission of TB in PNG, and assess the acceptability and accessibility of current TB interventions for TB control in PNG. I've been engaged with the TB study. I've also taken part in the writing part of it, where so far we have published 2 research articles already, as you can see on the screen there, with the names of the other co-authors as well. The first one is exploring tuberculosis risk scapes in PNG in a Papua New Guinea hotspots, and the second one is on beyond TB patient delay and navigating structural health system barriers and timely care and treatment in high burden TB setting in PNG. And all these are done, the writings are based on the data being collected specifically in Western Province. And the third one is still in progress, and it's on food insecurity, which will be published anytime when it is finished. My take-home message is, in any career path, you have to start somewhere, and as you tread on, you will learn the necessary skills required to help you become better at it. And giving your best in doing what you do with passion will help you come to realize the importance of what you do. And for me personally, as a researcher, it's like me opening a door to a house, and then the moment when I step in, it's like there are other doors and windows there for you to open. So thank you very much to all the my senior staff members and project coordinators who have helped me to become better at what I'm doing, and also looking forward to do what I can do in the research field. Thank you very much.
I'm just going to quickly close up this session. First of all, let me say that as social researchers, we're not very tech savvy, but I also want to just give a shout out to our amazing tech support for today. They're certainly earning their money's worth with our team, but thank you for their patience as we're wrapping up this particular session. I firstly want to acknowledge the Buttressing Coalition and the organisers of the virtual symposium today, and thank them for their time and for allowing us the space to present some of what we do in social research work in public health. I also want to go back to my point of us being human. I hope the takeaway message for everybody is that without the people that we work with, the communities that support us to do our research and to provide us with the nuance and detail that they do, we are then able to understand our communities better, but also through their own voice. How do we then address some of their concerns and issues in focused and practical and important, realistic ways? Also drawing on what Agnes has talked about, I think one of the prominent things that I've certainly learned at my time at the PNGIMR is about equitable partnerships and what that can look like. They're made possible because they grow over time. It's part of our research practice to grow and use methodologies as well and new technologies, and that comes with the support and the guidance of our partners, but it also comes with our own input into what is needed in our communities. From Herick's work, I think it's really important to take away a message of our social research can deepen our understandings, not just as a community or a public as a whole. It deepens us and our understanding as researchers as well. And to take a little bit of license over John's apt metaphor, research opens the door to answering questions. Behind that door, other doors might be available to open and explore and to find out the answers that can be useful for us.